Hello everyone, I am Dr. Pooja Sharma, Senior Consultant Obstetric and Gynecology from Daksh Clinic, Hoskhas, New Delhi. Today I will be discussing with you high risk pregnancy. What makes a pregnancy high risk? That means there are certain factors, there are certain conditions which make a pregnancy high risk as compared to other pregnancies. Now, the causes which can lead to high risk pregnancies can be either pre-pregnancy causes, that is the causes which were already there before pregnancy, or certain causes which can develop during pregnancy, or there are certain factors, there are certain conditions related to babies that can make a pregnancy high risk pregnancy. So let's take them individually. So before pregnancy, before a lady is planning pregnancy, there are certain medical conditions which make the lady susceptible to a high risk pregnancy. And what are these medical conditions? Number one, extremes of ages. Either too young age group or age group more than 30-35, especially 35 years plus, makes you a candidate for high risk pregnancy. Secondly, certain medical disorders like high blood pressure, diabetes, heart diseases, kidney diseases, lung diseases like asthma and bronchitis, certain autoimmune conditions, certain genetic disorders which, if present, can lead to high-risk pregnancies. Similarly, a lady who has had previous multiple abortions is again a candidate for high-risk pregnancy this time when she is planning her pregnancy. Now let's talk about the causes during pregnancy. Now, if a lady who does not had any cause that makes her susceptible to high-risk pregnancy becomes pregnant, then also there are certain conditions, there are certain pregnancy related disorders by which we categorize the pregnancy as high risk. What are these? Number one, multiple pregnancies. That means either twin or triplet or a pregnancy having more than one baby. Again, this is a high risk category. Secondly, if a lady develops high blood pressure during pregnancy, if a lady develops diabetes or altered sugar during pregnancy, then she becomes a high risk case. Similarly, there are conditions of placenta which can make pregnancy high risk. Low implantation of placenta, low lying placenta, or a lady who had a previous cesarean delivery and this time she is having a anterior placenta, anterior and a low lying placenta. These are certain high risk conditions. Certain anomalies of babies can make pregnancy high risk. So why are these high risk pregnancies important? These pregnancies are important because they need certain amount of extra care, extra investigations and extra follow-up by your doctor at certain times in order to give a better result for both mother and baby. So what can you do? How can you plan a fruitful pregnancy and avoid being a high risk pregnancy? Number one, whenever you are planning pregnancy, go for a counseling, meet your doctor and get a pre-conception checkup. Get yourself screened for these high-risk conditions, know your vaccination status, get your hemoglobin and basic workup done and see if your body is fit for pregnancy or not. Similarly, start taking folic acid supplementations before pregnancy. Thirdly, what you can do, you can make certain dietary modifications which will help you. Avoid taking alcohol, avoid tobacco, avoid excess unhygienic junk food before you plan pregnancy. Eat healthy, do regular exercise, take plenty of water, keep yourself hydrated, avoid cough and constipation before you are planning your pregnancy. Stay in touch with your doctor, go for regular follow-up, and I wish you all a happy and a healthy pregnancy. Thank you.